Hi, I'm Samantha Gonzalez Russell. I am a 3-time cervical cancer survivor living in Las Vegas, Nevada. And today I work to tell my story, to increase health advocacy, and connect our communities. I have experienced quite a wide range of symptoms. Particularly, I remember during or I should say before my first diagnosis, there was a lot of irregular bleeding. So anything that was outside of my normal period, I was having quite a frequency of a lot of pain, a lot of discomfort, and those were the primary symptoms that I can recall. For my second diagnosis, it elevated and I was feeling so much pain in my back, in my kidney area. I was feeling pain in my pelvis and my abdomen. And unfortunately, my doctors at that time had sort of chalked it up to a wide range of things, something more superficial, like a UTI. Now, of course, I know now it was something more serious. And then my last recurrence, again, was a lot of irregular bleeding. And so throughout my entire experience, that has been the huge red flag and something that I've learned that if there is blood somewhere, there usually isn't and really shouldn't be. That is a big red flag. I went to my OBGYN. At the time, she did follow the usual protocol, which was to investigate further. I did a pap screening, which did show abnormal cells, and then she also did a LEAP procedure, which I'm sure I'm not explaining this medically accurately, but it essentially is like a removal of that cell tissue to allow new cell tissue to grow and so that they can biopsy what they've removed. Again, that was shown as abnormal, and I was referred to a gynecologic oncologist. Now, the doctor I saw at that time wanted that procedure to take effect into my body, and she asked me to give it a little bit of time. And in my own fault, I gave it a little too much time and didn't follow up on it until months later. And of course, as those months went on, my symptoms became worse, and it got to a point where I got a referral to another gynecologic oncologist, and she was able to confirm the day that I met her through a physical exam that, yes, I have cervical cancer. A lot of devastation, a lot of guilt on my part, and criticism for myself to not have made my health, made these, a lot of criticism for me to not have addressed these issues, these symptoms sooner, and been more invigorated to do that. Whether it was finding a different doctor or asking a second opinion, I really wish that I had done so many things differently. Also, at the time, during my first diagnosis, it was a few months after my 27th birthday, and recently my husband and I just got married. We came back from our honeymoon, and that was the time where I found out about the first diagnosis. So to be a woman specifically in that stage of your life where you're really excited about what the future holds for you, and then to have this horrible thing crash into your life and seemingly take all of that away from you was incredibly difficult, and something that I've had to learn to process and heal from. Immediately, they wanted to remove the tumor. And so it was a very whirlwind process of booking me into surgery, I believe 2 weeks later. And the surgery was a radical hysterectomy. So it was like a robotically assisted hysterectomy, supposed to be minimally invasive. But again, for any woman, that kind of procedure is going to be a huge deal because it does alter your life and essentially what you think your life should look like. But I did the surgery. The recovery was actually pretty quick, physically. Mentally, I will admit that at the time I felt like I just needed to, get back on the horse and move right along. But now I know that there was a lot of emotional trauma there that I needed to process, that I needed to go through and let go of to truly be able to move on. So a hysterectomy is the procedure of removing all of your reproductive organs. And that was done so that the cancer wasn't able to spread anywhere else. And that is the region where it was already impacted. So for me, as someone who grew up wanting the conventional family and something that, my brand new husband and I had talked about, it was something very, very difficult for me to even wrap my head around. And beyond, impacting my family planning and my relationship with my husband, it really, I cannot emphasize enough the way that it impacted the relationship I had with myself as a woman. I think there were so many there are so many societal expectations. There are so many outside expectations that we put upon women that really had a very negative impact on me and the way that I perceived myself. And this is absolutely something that I've had to work really hard on to deconstruct, really. My doctors at the time didn't see that or didn't recommend that I needed additional treatment. My surgery at that moment had shown clear margins. So from their perspective, there really was no reason for me to continue any treatment. Now, knowing my story and how it unfolds, it may have been a good idea. But that is also another reason why I emphasize women or patients in general seeking a second opinion, because things may have turned out a little differently had I done that in the first place. It got so bad that I ended up in the ER because I had uncontrollable bleeding. And that is where my second diagnosis was confirmed. They did imaging. I had a large tumor present in my cervix/intestinal area. And that was when, after I found that information, I found a brand new team, and they were able to get me the treatment and care that I had been asking for such a long time. I met with a surgeon, and I believe it was a few days later, like within the week of meeting him, we went into surgery. He was able to successfully remove the tumor, and then I would meet with oncologists afterward. And I would spend all of 2019 in treatment, whether it was additional procedures to remedy the sort of other complications that I was experiencing from cancer or surgery or whatever other treatment. But I did undergo, I believe, I'm not sure how long it was, but I did undergo rounds of chemotherapy and immunotherapy. I moved on to radiation and a different chemotherapy, and then would continue my maintenance treatment with more immunotherapy. And by the end of December of 2019, I was done with treatment. I got a clear scan. And at that point, we felt like, man, we can really put this behind us. Now it is time to really move on and live our lives. And then, of course, in a few months, in March of 2020, of all the years, 2020, I did find out that the cancer had recurred again. And this time it had grown into a more localized area. I know that it had more deeply impacted my intestines this time around and other surrounding organs. At this time, my oncologists didn't have any more options for me. One of them, who I am very grateful for, encouraged me to seek treatment out of state because I had already gone through all of the cervical cancer protocols within the state of Nevada. The other, unfortunately, kind of threw his hands up and was like, I'm sorry, there is not much more we can do for you. Luckily for me, I'm very stubborn, as you can tell. And my husband and I were not ready to throw in the towel. So we sought treatment out in LA. And it really was a full circle moment because I had connected with a doctor early in my second recurrence just for another opinion as far as treatment went. And she was the one that I reached out to my third diagnosis. And she was ready to help. She was able to bring my case to her colleagues, and we went out there initially thinking that I was going to start brachytherapy, which is like an internal radiation treatment for my type of cancer. And after an evaluation and meeting with her colleagues, they decided that my best plan of action was to undergo a pelvic exoneration. And that is a very, very extensive surgery where they remove everything from your pelvis / like abdomen area, which will alter my life in the way that I live. But the important part was that it was going to give me a 50-50 chance of actually being able to have a life. So we did do that. My husband was there with me in the thick of the pandemic. We were not prepared for it, but we ended up living in LA for 2.5 months during that time. But I am very happy to say that ever since then, I've been in remission. I have 2 ostomy bags because of the pelvic exoneration. That surgery, when I say they remove everything, they're actually removing everything. And because my intestines were impacted by the tumor, they had to take it all. And they offered this surgery they don't take it lightly. They understand very much that it is a life altering decision. But like I said, I had come so far and I was going to live through this. So we decided to make that decision. And the process of getting used to it is like I've said so many times, I feel like I'm born again. At first, like healing from surgery, I had to learn how to walk around with all of these weird things hanging off of me. I'm learning new ways to go to the bathroom. I am learning how to redress myself because after all of that treatment, none of my clothes fit. I don't feel confident in what I'm wearing. I'm thinking, like, can everybody see what I'm working with here? It has been the adjustment of my life. But I will say, I'm laughing because so many of my doctors in the very beginning were like, I know it's hard right now, but one day you're going to be telling us, you're going to be showing us how this works, and you're going to be a pro. It's going to be like nothing. And in that moment, I was like, no, you're just saying that. I laugh because it's so true. It's almost been 5 years, and right now it's like second nature. Unless you have experienced cancer, in your life, like front and center, it's really hard to imagine what the aftermath is like. And I think there is a conception that like everything's great. You're just getting back to life. And even myself, I had that idea of like, okay, well, let's just get the show back on and everything's great. And I was very, very wrong because there were many, many, many things that I had to address for myself before I could actually move on. And so much of that, if not all of it, is my mental health. Spending, I mean, where do I even begin? It's a lot. Spending so much of what many people would consider like the prime of your life, you know, my mid 20s to my early 30s, and I did not have a job. I was isolated at home, so my job was to survive. And that's something that we're not able to just turn off as humans. So that in itself has been a struggle. I have been very, very privileged to have access to really great mental health practitioners to help me work through that. I had been dealing with a lot of PTSD unknowingly, and that meant that I was very hypersensitive to really anything. As you can imagine, going through so much trauma consecutively can also make you feel like you have an expectation of trauma that's going to happen. Like the shoe is going to drop at any moment, and it can keep you in a state of heightened anxiety, paranoia for some people. I will say also that finding the compassion for myself has been part of that process as well. That yes, it may be true that I've had to deal with a lot of these things. I can't speak for every patient, but there definitely was a part of me that believed I deserved all of these bad things to happen to me, and that would seep into all the other facets of my life. And so I would think so lowly of myself. I would think that a lot of good things weren't possible for me because I had experienced so much bad. So practicing more self-compassion, practicing more understanding allowed me to free myself of those thoughts and really to connect with others on a deeper level as well. I think we sometimes are under the illusion that we have a lot of control of what is going on in our life or how people show up in our life. And the truth is, we don't. And for me, practicing and focusing on myself and how I can support myself instead of looking outward has been life-changing for me. You know, you are the person who got you through all of your difficult moments. So give yourself some credit. You are the person who is going to be able to continue that trajectory for yourself. I know it's hard. I know that we want to jump back into our quote unquote normal lives, but it all takes time. It all takes space and grace. I have never ever loved my body more because she's the reason why I'm still alive. She is the reason why I have been able to endure so much. So, you know, also if there's someone that you're envisioning to be, goals that you're wanting to accomplish, love yourself now. Like you don't need to wait until you're that person. Education for women in particularly is incredibly crucial because when we keep up with our health, we really are building a strong foundation for our lives. And I just want to add that I've learned to remove the taboo from speaking about our health issues. For so long, for myself, I have been taught that, like, no, we don't really talk about our private parts. That's embarrassing. But why is it embarrassing? Why should it be embarrassing? These are parts that we all have. These are all issues. Well, hopefully not issues that we have, but by talking about them, we're educating each other, we're empowering each other to say, hey, I need to go get that screening. I need to talk to my doctor about this. But when we stay silent, we're just continuing a pattern of not addressing our own health issues and staying, or I should say, continuing a pattern of giving up our own control, really. So education is, I cannot stress enough, very, very important so that we are able to make decisions for ourselves.